Hello. I found a very interesting article entitled Empowering Individuals with Mental Illness to Develop Healthy Eating Habits Through Mindful Eating. The results of a program evaluation. So, the purpose and hypothesis of this program evaluation was to examine the lifestyle habits such as unhealthy eating among those with severe mental illnesses. It's been observed that those with severe mental illnesses are at higher risk for obesity and cardiovascular disease. Those with severe mental illnesses are also at higher risk of early death by as much as 10 to 20 years as compared to the overall general population. Some of the contributing factors to unhealthy eating among those with severe mental illnesses include some of the side effects of the medications that are taken, stress, anxiety, trauma, depression, emotional eating, and sometimes substance abuse can affect eating habits. Other factors that can impact this population is insufficient support and resources, and the impact of the symptoms on motivation, and sometimes the feeling of being out of control, which is very common with this population as well. To continue the purpose and hypothesis, the interventions to support healthy eating among those with severe mental illnesses need to evolve beyond the typical approaches that are often used in helping people control their eating habits, which often include nutrition education, food diaries, portion control, and meal planning. While these things are important, a different approach needed to be taken with this particular population. So the creators of the program decided to implement a mindful-based eating program, which approaches the focus on cultivating present moment awareness, acceptance, and detachment to be able to separate them from intrusive thoughts and emotions. And the hope was that this would help develop intrinsic motivation and control. Mindful eating has been useful in reducing obesity in other populations, but studies have not yet been done with those struggling with severe mental illnesses. The participants in this program, it was held at a recovery education program at a university-based psychiatric rehabilitation center. So they were serving adults with severe mental illnesses. The participants in the center all enroll in classes on a 3-semester basis per year, and this course was added as a possibility for those who were in the rehabilitation program. It was an option for them to take this course. 46 adults with severe mental illnesses participated in 4 rounds of a 14-week mindful eating and nutrition education program. The participants responded to questionnaires and provided qualitative feedback. So the class was scheduled at lunchtime, and it included brief meditations, hunger assessments, mealtime contemplation, eating slowly while noticing sensations and emotions, and managing distraction through noticing the breath and attending to physical sensations of satiety. The primary focus of the program was to address issues of mindless eating in general and to promote greater awareness of triggers, cues, and internal signals. The program builds on ideas of mindful eating and strategies to address mindless eating. The program facilitates observations of why, what, how, where, when, and with whom we eat, as well as understanding the impact of those choices. Mindfulness exercises can act to bring greater awareness of these influences. In addition, individual coaching included individualized goal setting, problem solving, and motivational interviewing techniques were used to help develop self-efficacy. So the primary theoretical framework of this program primarily utilized motivational interviewing as well as self-efficacy. The classes focused on topics such as mindful eating, self-compassion, and recovery using SMART goals, what we eat and when we eat, emotional eating and cravings, external influences on what we eat, mindful eating strategies to overcome external influences, internal influences on what we eat, hormones, thoughts, and feelings, mindful eating strategies to overcome internal influences, sleep deprivation, food and mood, strategies to improve sleep and change nighttime eating habits, understanding habits and reflecting on current eating habits. So these are some examples of the courses that they took, throughout the semester. So, findings and conclusions of this article states that the MEQ questionnaire results showed that the participants discovered that they had more awareness, were less distracted, they reduced overeating, and they reduced emotional eating. However, participants also reported being more affected by external cues. The TFEQ questionnaire showed that there were significant positive changes in cognitive restraint and emotional eating. A change was expected, but not a significant change, as was reported by the participants. Participants reported feeling more empowered by learning factors that influence their eating behaviors. This study was definitely appropriate for this population. It has promising implications for addressing unhealthy eating habits of those who struggle with severe mental illness. Outside of trauma patients, mindfulness has been shown to be highly effective in working with people with severe mental illnesses in general. Mindful eating is just another avenue to incorporate it. Many clients that I work with who struggle with severe depression, bipolar disorder, and trauma often report having bad eating habits as well, which also affect their mood, and it contributes to feelings of shame and guilt. Mindful eating could be a promising tool to assist patients who struggle with mindless eating, fast food, and junk food habits. Some of the limitations of this study is that it was conducted on a university-based rehabilitation program. The authors of this article acknowledge that this program needs to be repeated in a community mental health-based setting to further assess the efficacy of the program. Additionally, the authors stated that it probably needs to be expanded to evaluate the impact on health outcomes and to evaluate the durability of the effects to see if it's long-term. When I go over self-care with clients, one area that clients report consistently to find challenging is healthy eating habits. So this could be one more tool to help those who struggle in this way. And this concludes my article critique. I hope you enjoyed it. I found it to be very interesting, and I hope to be able to use what I learned from this in working with my clients in the future.